Klinefelter syndrome.
By Amber and Daria. Klinefelter's is a chromosomal disorder in males where they are born with an extra X chromosome. About 1 in every 600 newborns develop this disease. Normally, humans have 46 chromosomes. However, those with Klinefelter's are trisomic because of the extra X. A trisomic individual has 47 chromosomes instead of 46. In this case, this extra chromosome is the X chromosome. An extra one of these results in several irregular symptoms involving male sexual and cognitive development. Klinefelter syndrome is not considered an inherited condition. One would be unable to pass it on. It's simply a mutation, otherwise known as random change, that occurs during sex cell division. This results in an XXY karyotype rather than an XY karyotype. This extra X chromosome is caused by non-disjunction. This is when a pair of chromosomes fail to separate properly during the process of meiosis. In this case, the sex chromosomes undergo non-disjunction and are unable to separate properly. Non-disjunction of the sex chromosomes occur in meiosis. However, they occur at different points in men and women. Let's explore this deeper. In males, non-disjunction of the sex chromosomes happens during meiosis 1. A normal sex cell has a copy of the female chromosomes XX and a copy of the male chromosomes XY. When this cell divides in two, one cell is supposed to receive the female chromosomes XX and one cell is supposed to receive the male chromosomes XY. However, when the chromosomes divide incorrectly, one cell gets one X chromosome, while the other cell gets an X, a Y, and an additional X chromosome. This is just the beginning of the problem. When meiosis 2 begins, each of the two cells divide in half again, creating 4 cells. However, with incorrect division in meiosis 1, the chromosomes in meiosis 2 will divide incorrectly as well. This results in one of the 4 cells having an X and a Y chromosome, 2 of the cells having only one X chromosome, and one cell having no sex chromosome at all. So, when the abnormal XY paternal sperm cell combines with the normal X maternal egg cell, they form an XXY embryo. In females, meiosis 1 cell division occurs normally. The normal sex cell starts off with 2 pairs of the female chromosomes XX, totaling a number of 4 individual X chromosomes as a whole. When this cell divides into 2 cells, each one gets a pair of X chromosomes. During meiosis 2, however, the chromosomes do not divide properly. The 2 cells divide again, creating 4 cells. 2 of the 4 cells correctly receive one X chromosome. One of the cells incorrectly receive a pair of X chromosomes, and the last cell does not receive a sex chromosome at all. Lastly, when the cell that incorrectly received a pair of X chromosomes pairs with a normal cell from a male that contains only one Y chromosome, the resulting cell will have an additional X.
Klinefelter symptoms vary and may affect individual males differently than others, from being mild to severe, but they all tend to result in one thing: small testes and decreased fertility. Usually, the testes do not develop fully, affecting the levels of testosterone in the body, which is essential for male development. When testosterone levels are lower than normal, this results in the inability to produce sperm, causing the infertility. Other common symptoms include taller than normal stature, weak bones, decreased facial and body hair, decreased sex drive, and enlarged breast tissue. Due to the increase in breast tissue, as adults, males are just as likely to develop breast cancer as normal females. The diagnosis of this condition can be considered in adolescent males around the normal time of puberty, age 11 to 13, as one may start to notice the failure to develop normally. Males with this condition are not only affected physically, but mentally as well, such as learning difficulties. Many tend to experience at least one type of learning and language-related challenge. Some of these difficulties may include trouble processing what is heard, delayed speech, trouble using the language to express oneself, or, and not limited to, reading difficulties. Sadly, the sex chromosomes are unable to be repaired. However, early treatment can help minimize the symptoms. Such treatment may include testosterone replacement therapy to help increase testosterone levels in the body. Along with that, breast tissue removal and fertility treatment. Testosterone replacement can help increase hair growth, increase sex drive, and increase muscle mass. But even though the testosterone treatment boosts testosterone levels, it does not have any effect on male fertility. To learn more about Klinefelter syndrome, visit www.aaksis.org or www.rarediseases.org/rarediseases/Klinefelter syndrome.